Hi, this presentation is about how blockchain technology can be used to access participants for research studies and also how they can be motivated to make their data shareable. Even before the pandemic, health data was already a booming business, and I expect it to be even a much bigger business once the pandemic continues or will be over at some point. So what's the current status? If you ask patients if they're willing to share their data, 53% of severely ill patients are actually willing to share their data if they get compensated for that. And this was a study done with cystic fibrosis patients in the US. And it clearly shows that those patients who have a high amount of out-of-pocket costs due to their disease are also willing to share the data so they can reduce the costs that are having. And in total, one expects the digital health market to be $500 billion by 2025. And I would assume under the current development, this threshold will be reached even earlier. And health data, there's no objective value of health data. It's always how much somebody is willing to pay for the data. This is how much it's worth, but there's some indication of how much is paid for health data. If you look at very common post-market surveillance data, then one person can actually earn $167, or that's the median value in Europe for providing real-world data, and this is per year. So although the market is quite big, it has some flaws right now because lack of access to participants is really difficult, and it's actually the number one reason why medical studies fail and have to be stopped, because the recruitment underperforms. So despite having research organizations like IQVIA and all the other ones, which earns up to $70 billion per year. This is how much the market for clinical research organizations is, or contract research organizations. It's still very difficult to recruit patients for studies, and this is especially true in the area of rare diseases, where finding one patient that fits a certain profile can easily run up to $10,000 and more. And then you're not even sure if those patients, once you have detected them, are willing to participate. Or once they participate at some point, they do not respond, and then you have to throw away the whole data set. And if we talk about data, we also have to talk about privacy issues. The regulations are getting tighter each year, and so it's really necessary to have very good data privacy regulations in place and case-by-case consent, which means that like in old times when you were able to have a general consent that you can use the data forever, this is not true anymore. So you must be able to access those patients basically real time, case by case, if they're willing to if they are willing to share the data, or if they agree with the use of the data under certain circumstances. So this makes it very difficult and very expensive to access patient data. And this is the area where Centiva Health, this is the company that I founded with 3 other co-founders, is looking into. And what we're trying to provide is the missing link for data-driven healthcare. And we focus basically on 3 areas. So this is one, real-world data, as we call it. This is mainly data around treatment side effects. And the second area is population health data, which we're currently active in the area of COVID-19. It's gathering large-scale population data, especially on a regional level or country levels. And the third area, this is basically where I come from, being a trained psychologist, is data around behavior modification, adherence programs, where we basically use our platform to incentivize people, not only for sharing their data, but also for reaching certain goals. So how does it work? And where does blockchain technology come into place? Basically, the way it works is at some point you must have a reason to download the app. For example, you're participating in an adherence program, your insurance tells you if you participate in that prevention program, you have to download the app. Or in a current case that we're working on, it's with hemophilia patients, where the patient advocacy group tells the patients, actually, we're trying to get a much better databases for our registry. Please download the app. So this is the starting point for the platform. And then, contrary to other providers, we are not having a central data bank. So we just have using blockchain technology and the app. There's no central data bank. Actually, we are, I would say, data phobic. We don't want data at all. I know in most cases, the business model is around collecting data, trying to get better data, making better algorithms. This is not our business. We are only interested in transactions happening on the platform. So how does it work? We have the blockchain. Basically, we're using the NEM blockchain, which is a fairly old protocol. And what happens if somebody is looking for data, a research organization or a hospital, insurance, for example, let's say they want to do a study on diabetes. And then they say, okay, I'm looking for a diabetic man above the age of 50, they have a certain BMI, and I want them to monitor their blood glucose level for 3 months. And I pay them 100 Swiss francs. This is the offer. And the offer actually is posted on the blockchain. You know, a public blockchain can be read by everybody. It's basically a message board, and this is what we're using blockchain for. And this offer is posted on the blockchain. And the app reads the blockchain constantly. So when I downloaded the app, I forgot to mention that I enter a number of metadata. Where do I live? How old I am? My gender? My weight? If I have any preconditions? And in the future, we also intend to ask for medication. So the app has this information, the so-called metadata, but it's on the phone. It's never shared with anybody unless the user agrees to it. So this is totally decentralized, and that's also why we don't need to build up a central data bank. So this app reads the blockchain, and if there's a match between what has been put on the blockchain and what I have locally stored on my app, then I get a message, hey, Eberhard, there is a study that you can potentially participate, and by the way, you can earn 100 Swiss francs. So then I have the choice to accept this offer or deny this offer. If I deny this offer, there will be no connection made between the research organization looking for the data and myself. But what happens if I accept that offer? Then I'm guided to, I get a link that guides me to the data collection tool of the research organization, for example, or the hospital. And there I click on the link, and what we've implemented most frequently is RedCap, which is a very common tool used in research. It comes out of Vanderbilt University. And then I accept that, and then I fill out a questionnaire, for example, or in the future I hook up a device, or I just give access to pre-existing data which sits in a hospital, for example. So once I provide the data and click send or agree that it's being used, this is recorded as an event on the blockchain, and that immediately triggers the payout to my wallet, which is part of the app, the Centiva app. So, and then basically the loop is closed, and we all use blockchain just for the matchmaking and also for the reward payout. So we all know that the reward is only worth something if I can do something with the reward. I mean, if I pay out tokens, i.e. cryptocurrency of no value, nobody will be motivated to participate in those research studies. So there are basically two ways how those tokens can gain value. One is from summer on, the token can be exchanged for fiat currencies, which is Swiss francs, US dollars, and so on. Or the way we do it in our current pilot projects is these tokens can be used to redeem certain health-related services. For example, a discount on a medication or a special therapy, physiotherapy. Instead of paying it out of the pocket, it will be paid by a patient support program by those who are actually out to get this data. So this is the cycle of the data. And if we look into our transactional business model, as I said, we're not interested in monetizing the data, but somebody in the beginning has to have an interest in gathering the data. As I said, this can be a research organization, it can also be a government organization, healthcare, pharma, insurance, and so on. And they put out a price for the data, and then whoever provides or does work in curating the data, providing the data should be part of the monetization process. And basically, in the end, the patient or the individual should receive the lion's share of the money that's being paid for the data. So with blockchain and with a digital contract, it's very easy for each transaction to allocate money to those partners who have contributed to the data. And once the information seeker, that's how we call them, receives the data, they trigger the payout, and everybody who's part of the monetization will get their share. And you can find that probably very money driven, but the truth of the matter is, as I said in the beginning, it's already a big market, and usually those who contribute to the data, i.e. the patients, usually get nothing. So I think this is a very fair way of compensating somebody for data, and it's actually quite honest and very transparent. And we are increasingly seeing that this is a very much accepted way of dealing with data. So we have a couple of pilot projects, and one of them, it's actually the first one, is a project with TB patients in Vietnam, where they try to increase the treatment adherence among those TB patients by paying them if they come back for their follow-up consultations. A second one is collecting data on rabies vaccinations in Mali and Sub-Saharan Africa. We do that together with the Swiss Tropical and Public Health Institute. And there, the people who provide the data about the whereabouts of the vaccine, when it's being administered, and even the patients receiving the vaccines, everybody along that line gets paid for providing this data. And in the end, why do we do that? It's actually a lot of those vaccines just disappear once they're donated and or are getting sold on the ground, and this is not the intention of those who donate those vaccines. So with that data set, we are actually having a better track on grip on where the vaccines go. Our most current project is rare diseases, as I already mentioned. This is where a patient advocacy group in a European country basically tries to improve their registry with the data, and what they do is through our platform they incentivize the people, i.e. paid them a token when they provide the daily checkup of their symptoms, and with a certain amount of tokens that they earn, they can then redeem certain services in the healthcare system. So this is basically the loop that I described before. And what we're also currently, I already indicated that in the beginning doing is with around COVID-19, especially in sub-Saharan Africa and also South America, we are about to launch with some partners, which I cannot unfortunately reveal right now, an app where patients can actually share their data and also mark places where they have been. And once they have a positive COVID-19 test, then retrospectively those places are getting flagged on an official register that at some point there was a risk of being exposed to somebody who actually was infectious. And this has nothing to do with contact tracing. It's just basically tracking places where an infection risk has been present, so that everybody who has been at this place in the past can be alerted that they should monitor their symptoms. Okay, thank you very much for your attention, and if you have any questions, you can reach me directly under the email that you're seeing here. Thank you very much.